you're traveling soon for a while, but tell us about like the exciting things. Do you have a book number 3 coming out? What do you have in the future?
No more books for a minute.
No more. Yeah.
Look, man, the most exciting thing in my life is getting health systems to adopt these groups, you know, and that's where I'm focused on. So I'm going actually in 2 weeks to, I mentioned the American College of Lifestyle Medicine. They have 100 health systems that have put up their hand to say, we want lifestyle medicine. And lifestyle medicine, you know, is pretty basic. It's the kind of stuff that we're doing. It's helping people do healthy behaviors consistently. But the fact that 100 health systems, and these are some of the biggest systems in the country, like Kaiser Permanente, Intermountain Healthcare, you know, these are big entities that are putting up their hand to say, hey, we're interested in this now. That to me is exciting. And so, you know, I'm focused on, you know, trying to scale this kind of care, you know, to as many people as possible. I've had thought about writing a 3rd book, and I think I would call it The Economics of Chronic Disease. And I would sort of bring in, but it wouldn't be, I don't know. But I don't know if I'm going to do that. I think that's probably a few years out. I really want to be 100% focused in the next 4 years in getting access to as many people as possible of health-focused care through the payer system via these partners. And, you know, every moment that I spend on it is like really fulfilling. We're making some tremendous progress. And yeah, if you're listening to this and you have any sort of ability to influence decisions within health systems or payers or otherwise, you know, one of the most exciting things, Casper, and you know, you be in New York, you know that like there's been a lot of false dawns, right? So there's been a lot of moments where, oh, wow, there's going to be an integrative center at Mount Sinai, and it goes well for a few years. And then some new investor comes in and buys the hospital, and it gets canned because it's like, well, it doesn't make enough money. And it's like, you know, it's not profitable. Yeah. I think what we have the potential to do here is to create really sustainable, very significant size, you know, health systems that deliver health, you know, health creative services. And I think that is possible. And I think the Great Resignation and people leaving medicine is almost like feeding into that opportunity in a weird way. So can we find ways to get doctors on a path towards, you know, creating health? Can we do it both at the individual level, in the individual clinic level, and then at the health system level? And look, it's going to take a huge team to execute it. But I think there's more and more people, like you said, who are waking up to the fact that this needs to happen.